Well, good morning, everyone. How are ya? Hope you're having a great start to your day. Looking forward to our question and answer Friday. Always fun. Fun for me, at least. And we'll wait for a few folks to get their notices, and then we'll do our roll call. And Rosa, number one on the hit parade today. Jen, Cape Breton, good morning. Rosalinda, Niagara Falls. Nick from our staff, good morning. Mary, how are you? Jocelyn from Baxter. Mike from Norland. And Jen, good morning. Did you miss me yesterday? Brahim, good morning. Portland, Oregon. Rhonda, I want to sing, Rhonda, I want to sing. Nellie, Grace, good morning. Deb from Detroit, Motown, Michigan. Diane, Ottawa. Len and Judy, Edmonton, Alberta, bright and early. Maureen, good morning from Boca Raton, Florida. Michelle, Gloria, Jeanette, and Jeanette from our staff. Good morning, Jeanette. Fran from Orangeville, Pat. I wish I could reach out and give you all a hug. Kathy, good morning. Gloria and Fran and Jeanette, bonjour. Catherine, Parksville, British Columbia. Linda and Georgie. We appreciate it, guys. Nice to be missed. Heather, Francis, Christina, and Leela, Werner, and Jeanette from Kapuskasing. Mary Jane, Connecticut. Helena, thanks for coming on. Ashley, good morning. And Elaine, good morning. We love you guys. Annette from Ottawa. And Jeanette. Okay, ready to go. Martin, how are you? Ruth Ann. Irish Town, PEI. Julie. Joanne. Stewart, Florida. Hey, good morning. Donna. Rose, good morning. Carolyn Lee. Yolande. Yolande, I told you, I'll wait for you. Wanda. It's coffee time. Maria, yeah, I had my coffee this morning. And Maxine, bonjour. Corinne, good morning. Okay, guys, let's get going. Linda, St. Jude, Quebec. First question. Doc, from Kathy, what do you do about granuloma annulare? Well, that's a skin condition. Let me just give you overarching principles about the skin. Whenever you see anything on your skin, anything, think of your gut. If your skin is an organ, it's a large organ, but there's nothing, the connection between the gut and the skin are probably the greatest connection. Because you know me, I'm big on leaky gut, leaky lungs, leaky gut, leaky joints, leaky gut, leaky sinuses, leaky gut, leaky brain, leaky gut. But whenever you see something on the skin, almost invariably, it comes originally from the gut. If you don't fix the gut, you don't fix the big bobo. You gotta fix the gut. So I'm big on causes. So what causes leaky gut? The number one cause of leaky gut is antibiotics. Okay? Antibiotics. And again, I'm not against antibiotics. It's just that the problem with them is they wipe out good bacteria. And when that happens, and it can be years later, you get oftentimes problems on the skin, from psoriasis to eczema, whatever. It's always leaky gut to start. Okay? I'm not saying there's no other issues. Hormones can have an issue on things like that. The thyroid gland can have an issue with the skin. But you start with the gut. Fix the gut. And you fix the gut by broad spectrum probiotics. You fix the leaky gut. You tighten up the junctions so that nothing leaks into the bloodstream. You have to tighten up the junctions. How does that happen? Get the friendly bacteria to be the big army inside, the good guys. They'll knit together. Don't feed yeast because that's an invasive species that gets into the bloodstream and spreads to the skin. Don't feed it. Don't feed the bears. No sugar. A lot of times you eliminate the crappy carbs. You get rid of all the garbage in your diet and you fix leaky gut. Doesn't happen overnight, but you better fix leaky gut, okay? So, thanks for the question, Kathy. Gene, what do you think of hyperbaric oxygen therapy? Well, look, it's not my specialty, but I can tell you that, I know for wound healing, people that have been in, burns and severe burns, as far as, I've heard of it in terms of oxygen, in terms of even cancer therapy and whatever. It's just not my expertise, but I certainly wouldn't be against it, okay? And wound healing and even joints. But now I'm just commenting on what I can read. But I know about wound healing because that's been going on for a lot of years. Severe burns and that kind of thing would be good, okay? Alcy, is it okay to give a 4-year-old oil of oregano? Yeah, but it's how to give it. Now, because it's never, there used to be, and oil of oregano, I think they put them in, I saw the other day that you can get them in gummies. Now, I haven't tasted them, okay? But I love oil of oregano. You guys know that, okay? And I'm going to answer another question, okay? So if you can somehow administer to a 4-year-old, because it's like Buckley's. It tastes bad, but it really works, right? And, the problem with oil of oregano is how to administer. That's why I always love the sprays, but it's strong. It's spray and pray. Now, let me answer another question about oil of oregano, okay? Because somebody else asked the question 10 minutes. Let me just get to it. Okay, where is it here? Okay, Nancy. Since oil of oregano is great for killing bacteria and viruses, yep, does it affect healthy bacteria in your mouth? Now, Nancy, thanks for the question, because we talked about that in one of our newsletters this week, didn't we? Mouthwash, okay? Mouthwash. The problem with mouthwash, especially if it's alcohol-based or whatever, is it destroys, they even advertise this. 99% of all germs. You don't want to do that. You don't want to wipe out all germs because, first of all, not all germs are bad. Not all bacteria are bad. There's good guys. And look, we're made to live around bacteria. That's why I'm always against over-cleaning. And look, oil of oregano, what is so beautiful, and I have been saying this for 40 years. Listen to what I'm going to say. Oil of oregano is God's gift for an antibiotic, natural, antiviral, natural, antifungal, natural. Okay? It's an antioxidant, natural. And in nature, When you take something that's in nature, like oil of oregano, it kills the bad guys, not the good guys. Yeah. It doesn't wipe out 99%, 0.9% of your bacteria. It is a gift. It's a gift of God. I'm telling you. And it don't wipe out. This is why this is why we put oil of oregano in our digestive enzyme, because we're going after SIFO, small intestine fungal overgrowth. It's a fungus, okay? I know they say bacterial, but it's really a fungus. But doesn't matter, oil of oregano differentiates between the good, bad, and ugly bacteria, guys. I've shown this over the years. I've said it consistently. It's not like an look, if you get hit by a truck and you're in the hospital and for infection purposes, they're giving you antibiotics, IV, listen, that's what antibiotics do. They can save your life. Now, oil of oregano is a natural antibiotic that destroys bad guys, but not good guys. That's why you can use it every day. That's why you can use it even orally. You can brush your teeth. That's what I like to do with oil of oregano. I spray oil of oregano on my toothbrush, or you can put a drop of oil of oregano on your toothbrush and brush your teeth. You're not killing all the good guys. That is so important. That's why when you go into your kitchen and you look at the chemical cleaners that they have, most of them will say kills 99% of all bacteria. Well, you know what? It's wiping out the good with the bad. That's what antibiotics do. They wipe out the good with the bad. You're throwing the baby out with the bath water. And that's why it can come back to bite you later. And this is why I talk about leaky gut, leaky skin, leaky gut, leaky lungs, and sinuses, and all these things. Your body has a protective layer of bacteria. Don't destroy it. Don't destroy it. From your head to your toes, okay? Your gut being the place where you have the most bacteria, okay? So oil of oregano, there's just nothing negative about it. The only problem is it tastes awful. It's not, it's not easy to take in a lot of ways. So for a 4-year-old, like if you can somehow administer it, then for sure it's good for them. For sure it is. Okay? Okay, let's see now. Colette, what are Dr. Martin's thoughts on milk thistle for the liver? Well, listen, I like milk thistle. I got no problem with it. But when you talk about the Costco parking lot, the liver, what goes wrong with the liver? Fatty liver. When your liver enzymes are up, when your liver is not doing its job, when your liver is not creating the amount of triglycerides, the low amount of triglycerides, the high amount of HDL, your liver is gummed up. How does your liver get gummed up? With fat. It's the diet. So you can do milk thistle. I got no problem with it. But better yet, do the reset. The reset empties your liver. Okay? The reset empties your liver. When you choose the right fuels, your liver will empty itself. When your liver empties itself, there's a couple of things that are going to happen. One, you're going to do better hormonally, because a lot of, especially the thyroid hormones, are manufactured, the T4 to T3 is done in the liver. The other thing is that you are producing glutathione. Glutathione is God's gift of Velcro. It's Velcro. It travels through your bloodstream and it's looking for toxins. Again, glutathione, you need to have a clean liver for that to produce high levels of glutathione. I love glutathione, not in a supplement, what your body produces. And the more eggs, meat, and cheese you eat, the more you produce glutathione. Yeah, okay? So liver is really important. If there's an organ more important than your liver, really, it's, you know, I always joked about it because we called it the Rodney Dangerfield of your organs. I mean, it's ugly and people gets no respect. But it's a big, big, big issue in our society today. Nothing has changed more than the liver disease, which again, if you go back to the introduction in society of a certain sugar called high fructose corn syrup, I tell you, I've been screaming since the day it was put into foods. They switched the sugar and they were out. They didn't mean to, because they didn't even think of the ramifications of it. They're killing people by fatty liver. How do you die? Slowly, fatty liver, because it's at the precursor to diabetes. And diabetes is, or insulin is the precursor, insulin resistance is the precursor to cancer, to heart disease, to Alzheimer's. Liver. Okay? Liver. Good question. Thank you very much, Colette. Diane, is there anything to be done for pelvic varices in men? Well, look, that makes a person much more susceptible to deep vein thrombosis. Okay, so it's like varicose veins in the pelvic area. Yeah, look, your body's smart. It will create collateral circulation, but I love Navitol. Navitol is because it elevates your nitric oxide. Vitamin D elevates your nitric oxide. You want to keep your circulation. So I do Navitol. I'm high on, DHA. Lubricate. Okay? Thank you for the question. Okay? I've read that low levels of vitamin D3 and B12 could be the cause. Well, look, vitamin D, we just talked about it. B12, possibly. Okay, B12 is important for nitric oxide too. Good questions. Rita, my right knee is making a clicking sound. It's talking to you. Well, look, don't worry about the clicking sound. Worry about the health of your joint, Rita, okay? So if you have, I have arthritis in the knee, damaged cartilage. Any suggestion? Well, keep your joints lubricated. You need lubrication, okay? Why do you think I love collagen so much? Okay, I love bone broth. Why do I love bone broth so much? Because it's got collagen protein. And that is, collagen really helps lubricate your joints. So does high DHA. Look, you should be taking so much oil, Rita, that you're sliding out of rooms. Butter is oil. Okay? High DHA is oil. Okay? Oil. And bacon is oil. Lubricate those joints. Lubricate your skin. You need an oil change. Use the right oils, okay? You need an oil change. I'm big on changing your oil. I don't know much about my car, but I know I need to do an oil change, okay? My grandson's a mechanic. You know what he told me, Grandpa? You know what happens to your oil? No, I said, I have no idea. I said, why do I have to change it? See, I ask questions. Not that I understand anything about my car. he said, Grandpa, you need to change the oil. Why? I said, why? Tell me why. He says, because your oil loses its viscosity. And you're going to damage your engine. He said, you can run out of gas. I mean, you get stranded. Don't be stupid. Don't run out of gas. But he said, that won't damage anything. But he said, if you don't change your oil, you're going to damage your engine. I said, okay, I got the memo. Off to get my oil changed every, 3,000 miles, 5,000 Canadian kilometers. I don't know exactly when, but I do it, okay? Folks, change your oil. Oil is important. If you're on margarine, here's the memo. Get off of it. It's killing you. It's the wrong oil. Change your oil. Lubricate your joints. Butter. Bacon oil. Bacon's got the same as olive oil. Okay? You got olive oil, oleic acid. What makes olive oil so good? Olive oil is a good oil. A good cold pressed oil, olive oil, is good for you. 100%. But so's bacon. It's got the same oil. Yeah, it's oleic acid, folks. And to be honest with you, I like bacon more than olive oil. I like olive oil, but I like bacon more. Have your bacon. Okay? Hey, folks, that's the truth. Oh, Dr. Martin, what about the nitrates in bacon? Who cares? There's nitrates in vegetables. Nobody talks about those. Okay. Now, okay, so Rita, you know what to do for your clicking sound. Beverly, if you lower your triglycerides, does your HDL cholesterol always goes up? Okay? Or is it that having HDL allows your body to remove the triglyceride? Okay, now let Beverly, thanks for the question. It's always good to go over this. When you do the reset, okay, and you empty your liver, okay, triglycerides go down, okay, and usually, okay, 99% of the time, and I mean this, triglycerides go down, HDL goes up. Okay? HDL goes up. It's a teeter-totter. Most people, because they have some form of fatty liver and metabolic syndrome, their HDL is down here and their triglycerides are up here. Very dangerous, no good for you, and you need to change that. That's why when you send me your blood work, please try and send me your Some people just send me their triglycerides. Don't do that. Send me your triglycerides with your HDL. It's the ratio. Because I want to see, because a lot of people, I'm telling you, are upside down. They got low HDL and high triglycerides. That is very dangerous. Doctors, unfortunately, okay, just going to say it, they've been so programmed. You have to understand, I'm an old guy, okay? You have to understand, in school, if you were in school in the 60s, in the early 70s, cholesterol, even though the world was getting stupid, medicine hadn't got stupid yet. Cholesterol, you need cholesterol. Wasn't the boogeyman yet. And so they talked about triglycerides. But all of a sudden, and I mean it, it was like a paradigm shift occurred in medicine. And when the big pharma invented statin drugs in cooperation with big food, the cereal companies, cholesterol, cholesterol bad, cholesterol the boogeyman, Cholesterol, scary, scary, scary. It's clogging up your arteries. And then the whole world went for it. They forgot all their biochemistry. I mean it. And they even made something up. You know what they made up? HDL. LDL. They made it up. They made it a bad guy. You know why? Because they got a drug that they could lower it. I'm gonna hammer down your cholesterol. You gotta get, guys, 99.9% of medicine, nurses, dietitians, nutritionists, whatever, they still talk about cholesterol. You can't get it out of their head. Instead of talking about you need high cholesterol. You want to live longer? Yeah? Well then, elevate your cholesterol. God doesn't trust you. I always tell people that. God don't trust you. What? Well, God makes 85% of your cholesterol. You're responsible for 15%. Do your part and eat steak. But guys, I'm telling you, it from the get-go, it drove me crazy. It's not science. Nobody dies of a heart attack from cholesterol. It's like blaming the firemen because they're at the scene of a fire. Of course they are. They're the good guys. A policeman is at the crime scene. Hello? Yeah? Of course a policeman's at the crime scene. They're not the bad guys. Cholesterol is your friend. If you insist on keeping it low, you're going to be in doo-doo. You're going to be in trouble. Because you need cholesterol. Your hormones didn't even work. You see, one of the biggest things, okay, and I know I'm getting off on a tangent, but just give me a minute. Ladies, hello, you ladies, listen. Linda, please. When they started pushing fat-free, okay? Patients used to come and say to me, Doc, I'm eating fat-free. How can I be how come it's not working for me? I said, because you're not supposed to be eating fat-free. I want you to be a fat head. What? Please. If I call you fathead, take it as a compliment. You need fat. And you need cholesterol. And cholesterol is only found in the animal kingdom. There is no cholesterol in plants. None. Zero. Nada. Does that make plants no good? No. Plants are all right. But you can't ever convince me that cholesterol is bad, because it's in the animal kingdom, and God wants you to eat eggs, cholesterol, meat, cholesterol, and cheese, cholesterol. Eat your 15%, and God will do the rest. Okay? So, did you like my little tangent? I can't even remember why I went down that path. Oh, Beverly, yeah. Bev was asking about HDL and triglycerides. Okay? Now, there's the odd person, okay? And I don't call them weird anymore, because I've been told that that's not right to call people weird. So I call them unique. You're unique. Because there's been the odd person who said, Doc, my triglycerides went up. Hey, you're weird. No, I mean, you're unique. God gave you fingerprints, and yours are different than everybody else's on the planet. So in a way, we're all unique, aren't we? Right? Okay, but some are just more unique than others. Okay? I would tell certain patients, okay, in the office, don't donate your body to science. You'll confuse them. Okay? Some people didn't appreciate my sense of humor, you know. No, seriously, I used to have, look, I had to make my day enjoyable because I love people and I love my practice. So, but, you know, some people would tell me, Doc, I don't, you're not funny. Who said you were funny? I said, well, I have to laugh at my own jokes if you don't. Okay. Good question, Beverly, okay? Donna, what do you think about cultured oil? I like it. It's an oil, it's a fermented oil. Yeah, I got no problem with it. I love oil, the right oil, okay? The bad oil are vegetable oils. Those are terrible oils because they were made for your car, not for you, okay? They can run jumbo jets on them, okay? So when you see those clear oils in the middle aisles of your grocery store, avoid like the plague. Those are terrible oils. They will create an inflammatory response in your body. And one thing is, when you get on the reset, you're not on any of those oils. From cookies to whatever they make in the middle aisles of your grocery store, those are terrible, terrible oils. Okay? Good question. Lucy. No, Lynn. Don, what do you think of alpha-gal syndrome? Well, it's rare, okay? If you have that, you got to avoid red meat. I feel sorry for you. Again, it pretty well makes you unique. I mean, alpha, you know how many times I've seen that in 46 years of practice? Once. No, you just got to be careful. It's the way. And by the way, that's usually autoimmune. It's an autoimmune disorder. Lynn, what causes excess earwax? Well, look, there can be some, some people just make more wax than others. The worst thing you do, don't just pound it down, okay? Better if it's bothering you to get it cleaned out, okay? And there's a couple of ways you can do that and do it safely. Be careful with that. You need a certain amount of wax, but when you get too much, and at the end of the day, a lot of times, what happens in the middle ear is something, again, that I link back to the gut. Folks, Hippocrates was right. All diseases, he said, start in the gut. Imagine saying that 2,000 years ago. Like smart as a whip, right? And I'm big on the gut and the bacteria in there and the war that goes on. And, usually when you get excess earwax, I see that as being part of a fungal infection. Okay, that you don't really think so much, but it starts in the gut. Lucy's asking this question about autoimmune. Any autoimmune is leaky gut, any of them. I never saw a patient in my office from rheumatoid arthritis, psoriatic arthritis, Crohn's, lupus, MS, you name the autoimmune, Sjogren's, even the thyroid, Graves, starts in the gut. Fix the gut. Change the diet. Get on the reset. Change your fuel. Change your gut. What a difference it makes, my friend. Terry, iodine sensitivities. Well, some people, again, this is a rare. But some people just, with iodine, be very careful, okay? I like iodine because your thyroid doesn't work without it, but neither does it work without your selenium. I've always said that. Iodine. I like iodine. I like iodine. But you better have selenium with it, okay? So sensitivities, be very careful. Then don't eat kelp or whatever where you'd have more iodine. Okay, Terry? Annette, what are my thoughts on chelation? I like chelation. Probiotics chelate. Did you know that? If you have a good broad spectrum probiotic, chelate. You know what chelate means? The word means it bites off. It bites off more than you can chew. See, chelation is, after World War II, the Canadian and American governments got together because of lead poisoning. All these soldiers were touching this ammunition all the time. And they come home and they got lead. They had lead poisoning, a lot of them. And so the governments put their heads together and developed a solution, a vinegar-like solution. It was called EDTA, okay? And EDTA actually chelated, okay, bit off the lead. And I'm big on chelation. I love chelation. The best chelator is, by the way, is your liver when it's empty. When your liver is doing its job, it's a natural chelator because glutathione is a natural chelator. And, okay, I used to, in my practice days, had EDTA, okay, that I would, because EDTA, like you can get that intravenously and to chelate heavy metals out of the body. But if you do a broad spectrum probiotic and the reset on empty your liver, you're chelating heavy metals out of your body. Because one of the ways heavy metals is transported in your body is by yeast, fungus. Hey, we're back to the gut again. That's how you get mercury up to the brain. That's how you get lead in the brain. How does lead get up into the brain past the blood-brain barrier? Yeast. It's a transporter. That's why I'm so big, guys, on leaky gut and that fungus. Yeast, Candida albicans, invading. It's an invasive species. And that's why I'm so big on don't feed the bears. Don't give it sugar because it makes yeast grow. And the more yeast grows, the more it transports heavy metals. Listen, you and I are all exposed to heavy metals. Okay, good luck if you think you're not going to be exposed to heavy metals in this day and age. High fructose corn syrup has mercury in it. Yeah. They don't tell you that, but it does. But if your body's in good working order, it'll chelate it out of there. And like I say, liver and gut go together, okay? Thanks for the question. We appreciate it. Okay. Sharon, post-menopause. Sharon, I feel for you. I get horrible hot flashes, moods, feel like a zombie. I do have Hashimoto's, but no one knows what it is. Do you? Yep. Okay. Now, Sharon, okay, look at my face. Okay. See me? I'm a man. So what do men know? Not much. What do we know about hormones? Not much. But I tell you what I do know. 100% for sure, Sharon. Okay? You got hormones. Yeah, but Doc, I'm postmenopausal. How can that happen? You're still a woman. You're a woman. Okay? And women are complicated. You got ovaries. That complicates the universe. okay? It makes the stars unline themselves. It makes the planets get out of line. Because, ladies, listen. Some women, they have menopause. They pray for menopause because they're so tired of hormones. And they pray for, and I say, be careful what you pray for. Be careful what you wish for. Because it doesn't matter how old you are, ladies. If you're out of balance, I know 80-year-old women that still get hot flashes. What? Yep. Because you're still a woman. Now, you're not, you're not making the hormones. Oh, by the way, Dr. Martin, you don't know what you're talking about. What? I had a complete hysterectomy. Do you think that that God hasn't given you plan B? Your adrenals make hormones. Now, you're not gonna, when you get menopausal and postmenopause, you think you're not making any hormones at all? Of course you are. You're just not making as much. But the key is balance. It's, you know how I talked about that teeter-totter? It's always a balance between estrogen and progesterone. And when you're out of balance, the key for a woman is balance. Men, thank God, we don't have hormones. We couldn't take it. We're big babies. Ladies, you know that. Right? Men, we're babies. And we could never have a baby. So when you see in the news that men can get pregnant, dismiss. It's stupid. Because God said, nah, man, they're big babies. They could never have a baby. And they could never have hormones. They wouldn't know what to do. They'd shoot themselves. I was always a woman's doctor, okay? Women I had, because I measured hormones. And if I could only get to the medical profession to teach them that. They'd rather put you on an antidepressant. Oh, you're depressed. You're depressed. Of course I'm depressed. I don't feel good. What do you think? If you had hormones, Doc, you'd be depressed too. Don't put me on an antidepressant. Fix my problem. I gotta stop getting too excited here. Okay. Sharon, there's hope. There's hope. Okay? Okay. Peggy, if insulin is supposed to remove all sugar from the bloodstream right away, how does it manage to get to the brain? Okay. Now, Peggy, good question. You're thinking along with me. I like that. No. Insulin doesn't take all your sugar out of your bloodstream. Okay? You don't need a lot of sugar. You hardly need any at all. Okay? But it will lower if your body needs sugar, it doesn't really need it. Because if your brain needs sugar, your body will turn steak into some sugar. Okay? I like the way you're thinking, because you're thinking, well, it's parking. Believe me, the insulin is the traffic cop. Out, 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 out. But if you empty your 5 liters of blood, you'll be left with less than a teaspoon. Okay? So there's a little bit that's left in there, but that's for use right away. If headquarters calls for a little bit of sugar, it'll call for it right away. Okay? So, but it'll take it from steak. Better to get your sugar from steak and eggs and cheese. Not that it's added. It's just that your body knows what to do to get fuel right away. And the best fuel for your brain is not sugar at all. It's actually fat. Your brain operates better on fat. Okay? Thanks for the question. We appreciate, I think this is the last one. I answered Nancy's with oil of oregano. Deb, I would like to know if both raw garlic and onions can trigger esophageal intestinal reflux. I guess. Look, you got to figure that out, Deb. I mean, if you eat raw garlic and onions, don't call your friends over. You're going to blow them away with your breath. The garlic. I used to have patients come in and they tell me about, hey doc, I take raw garlic. It's good for me. Yeah, I can tell you take it. Okay. Was I against it? Of course not. It's good for you, but, okay. But if it bothers you, well, you got to figure that out. Okay. Because most people don't get bothered by that. Okay. They don't, most people don't. And if you have some kind of reflux, usually it won't bother you, but it might. And you got to figure that out, okay? Everybody's different, okay? Sugar will bother your reflux, will cause reflux more than anything else. Okay. I'm breathing. Okay. Did you guys have fun today? Because I did, okay? Have I told you lately that I love you? I haven't? Okay, I do. Thank you guys. We appreciate you guys so much. We're looking forward to another great week coming up next week. And you got questions, don't be shy. If you want me to have a look at your blood work, don't be shy. We're happy to do it, okay? I'll just make some comments, okay? Make some comments. Okay, we love you guys and we'll talk to you soon.